I think a lot of the time it is the assumptions that people do need support. Sometimes they don't. There are community networks, there are support systems that are already functioning, and sometimes if you go from the outside and try to disrupt that, you might create more harm than good. So you have to be careful about the kinds of support and services that are delivered, and the assumptions that people do actually need them, and it will be helpful by providing them.
We can be much more specific in who needs our help and not. We have to much better understand those dynamics that are happening that victimize people, but also how people use the agency to cope, to come out of their situation.
We often forget the agency of people, that people, even though their situation is very, very desperate, very difficult, but still they make certain choices. They do they have certain capacities, but very often that is often not very recognized.
It would be very much better if especially social services are more specific and look into the individual cases, what people actually need or not need. And to move away from assuming vulnerability according to a particular category, particular label. Survivors of sexual violence, internally displaced people. There are probably people in Eastern DRC that are not internally displaced, they have not been violated, but their poverty is much worse than some of the people from that category.
What's missing, I think, from a lot of international support is a kind of recognition of the power dynamics that are more about how the system as a whole works. So a good example of this is in Sierra Leone, where you have district nutritionists. In all cases, the district nutritionist was a woman, and she was often the only woman on the district health management team. The women actually struggled to sort of put forward their case and to be able to get a good share of the resources. And that meant that actually what you saw across districts was a lower budget for nutrition than for other aspects of healthcare, for instance. These sorts of relational power dynamics are actually something that affects the state's capacity to do things like prevent malnutrition, for instance.
When there is conflict, emergency, everybody gets into this emergency mindset, and that's when humanitarian principles kick in. And somehow, whoever decides we are no longer in humanitarian crisis, now we are ready to go to the development phase of this particular area, then the humanitarian principles are out the window, and then development principles come in. There is a disconnect between these two.
The end of actual conflict doesn't actually mean the end of every, vulnerability and every risk that people were exposed to during the conflict. In fact, what happens is that people's experiences of conflict tend to live with them for a much longer time, and in some cases it even ends up for an entire lifetime. And that means we need to move away from thinking that, when I provide a 2-year, 1-year funding, that is enough to enable people rebuild themselves. But I think we need to start looking for much longer term engagements